My name is Mannan Mridha. I work at this department, Technology and Health, teach biomedical engineering. My presentation will be a little different from the ones you had earlier. This is about utilizing the information and communication technology to bring the knowledge and medical devices and medical experts to the people who don't have access to all these. I did my PhD in Linköping in the late 80s with laser Doppler technology, and worked with work at Tokyo University with my postdoc on MRI. And I felt not very content because none of those technologies were dissipated to the global population. And then I worked with World Health Organization, and my origin is from Bangladesh. So I was pretty well exposed to the developing countries' problems. And then when ICT, information and communication technology, is state of the art, computers are cheaper, medical devices are portable, robust, battery operated, then I thought it is the time to bring the medical doctors to the villages in the rural areas. So basically that's what we are doing. We are trying to bring medical technology that is affordable, available, portable, battery operated, as well as bring the medical expertise from the cities to the villages, because the doctors don't want to go to the villages for various reasons. And so this project is about application of those tools, methodologies, strategies, and available, affordable equipment. Some of those we have devised ourselves, others we have procured to address these health problems and bring the science and technology to the villages, bring the technology to the poor people who don't have access to it. So there are three elements here. One is simple technology. Number two is awareness building on preventive healthcare technology. You might know that 10 million children are dying each year before they reach 5 years of age, and half of that can be eliminated because that is because of diarrhea and respiratory disease. So why ICT is so important? Basically because it is a cheap way of communication, and it has potential to empower people and thus bring socioeconomic development and all that. I share with you this Dr. Salam, a physicist from Pakistan. He said the rich and poor is not because of access to or not having access to resources, but it is because of access to technology or knowledge. Brigitte mentioned about cardiovascular diseases in the developing countries, and I also want to inform that it is really the case, and 80% of the people in the of those who are dying of heart diseases are from developing countries. So we are addressing that area too through this telemedicine project. So as I mentioned, there is a critical shortage of health workers, and we know that there is a strong correlation between number of healthcare providers and the disease reduction, and telemedicine can bring a change, and we are working with that project. I'll give you an example from one center in Bangladesh that we have been working with. It's funded by Spider. We are empowering the health workers who are working in the village, and we have created video conferencing facility where medical doctors in the city can give quality diagnostic consultation. Some of the sessions I had from our department here and from my room where doctors of Bangladesh origin helped the rural patients with the diagnostic consultation. And we are focusing on education and training simultaneously with the medical consultation and treatment advice. That is awareness building, education, seminar, training, and networking. We are also developing content for the mothers and pregnant women in their own language, the way they're able to perceive, again, for awareness creation. And we believe it can improve access to care, it can bring quality improvement, effectiveness. And then there are issues to be addressed, that is local context, the culture, the economy, and finally the cooperation and collaboration. And here I would see collaboration and cooperation from medical doctors community from Karolinska Institute to function as experts viewing the diagnostic information, because we have now equipment like whether you have anemia or not, whether you have diabetic or not, whether your kidneys having problem or not, ECG, blood pressure. But we are hoping to increase the number of devices with ultrasonic, again, affordable, manageable, portable devices, and thus will be able to improve the services. Thank you.